problem of insurance for the vulnerable in Texas is well documented. The route to disenfranchisement for my Afghani refugees is slightly different than those that were kicked off aid, but certainly there. I think the additional challenges that I see are, I'd say that there are three that really stand out to me. One is a profound sense of loneliness and disconnection. Even in apartment complexes where, there's a certain vitality to community life that we don't experience in suburban American life, people are not, just as we've all experienced at a party or anything, just because you're around people doesn't mean that you're actually nurtured at that really deep level that everyone needs and needs even more. So I think a profound sense of loneliness and disconnection is one. The second thing I would add is while I was at NAMI, I led a piece of research that suggested that, the pool there was anybody who experiences kind of a mental health struggle or the caregiver of someone who does. And we found that people experience medium crises at a rate of 5-to-1 of severe crises. And the way that we defined medium crises was something that leaves a painful or traumatic memory, but isn't necessarily imminently life-threatening. And, those medium crises and the radar that we have in society to pick up and notice when that kind of reverberation that hurts is happening is so it's so unknown, and it's so hidden, but we know that that's what ends up being a tsunami of despair eventually. And so noticing and then of course caring when people are going through those medium crises moments. It could be, chronic pain and a bout of chronic pain. It could be episodic anger that's really painful to a family member that's a caregiver. There's a lot of different examples of what that is, but they're so unnoticed. And then the third thing I would say is that, we've become as a society so obsessed with healthcare instead of health and care. Healthcare is so, it's become so administrative, and logistical and transactional when the root of it is supposed to be a relationship. A piece of research that really changed my point of view on this issue is Hilary Cottam is actually like a welfare specialist from the UK. She's coined a term called relational welfare, but she did this ethnographic kind of deep dive into one family and their 30 years of care of travel through the welfare system. And basically in one chart, everything was noted. And there was one relational interaction and 200 dots that were somehow, administrative or reporting oriented in nature. And so even when after all these barriers, people get themselves to a spot of healthcare, making it relational and making it really able to, in a reactive way, solve that person's biggest pain point at that time is, it's so hard. And I notice that a lot with the communities I work in as well.